And now I'd like to jump into a little background on the history of keloid treatments. So, as many of you might already know, keloids have been notoriously difficult to treat given their high persistency and high recurrence rate. Historically common treatment options included intralesional steroid injections, intralesional 5-fluorouracil injections, surgical excision followed by intralesional steroid injections, surgical excision followed by radiation therapy, laser therapy, topical pharmaceutical agents such as imipamide, and external cryotherapy, and the procedure that we're going to be covering today, intralesional cryotherapy. So, intralesional cryotherapy was first documented and reported back in the early 1990s by Dr. Washahi and Nuti et al. And in these studies, they outlined the general procedure of intralesional cryotherapy, which generally involves the insertion of a probe or needle into the core of the keloid and the administration of liquid nitrogen to effectively freeze the keloid from within. Cryotherapy was invented by an Israeli company and was later approved by the FDA in 2006 for commercial use. So now we'd like to jump into more detail of intralesional cryotherapy. So the first step is skin preparation, in which the skin is prepared with chlorhexidine and draped. The local anesthesia is then applied using lidocaine with epinephrine. The second step is the cryoprobe penetration of the scar, in which a sterile double-lumen cryoprobe is inserted through the core of the scar along its longitudinal axis, and care is taken by the practitioner to prevent penetration of adjacent unscarred skin. Steel gauzes are also administered between the patient's skin and protruding ends of the cryoprobe in order to protect these areas from unintentional freezing. Now, within the freezing process itself, the cryoprobe is connected to a canister containing liquid nitrogen pre-filled 3/4 the way of the cryogen volume around 15 minutes before the administration. And during this process, liquid nitrogen vapor flows throughout the cryoprobe out into the atmosphere through an escape tube. Freezing is rapid and may be assessed visually or by palpation. Now, the extent of the freezing is at the margin is best assessed by palpation of a very distinct, hard subcutaneous shoulder around the base of the scar. And when this point is reached, liquid nitrogen flow is stopped, and the cryoprobe is allowed to thaw for 1 minute before removal. Now, the last step is post-operative management, and oral analgesia is provided as needed, typically for the first couple days following the treatment to relieve any potential discomfort. Patients may also be given several dressings to apply at home, as serous discharge is expected to be significant within the weeks following the treatment. And now we'd like to take a look at a case study. So these 5 images belong to a 30-year-old Asian American female exhausted with numerous injections of cortisone, 5-fluorouracil, and more recently surgical excision followed by radiation therapy. And as these methods proved largely ineffective and there was high recurrence, she visited a Northern California dermatology clinic for intralesional cryotherapy for the resistant keloid. And starting from your left-hand side, the image on the far left represents the start point of the treatment, and the weeks and months following on the right-hand side of the image represent the weeks and months after the intralesional cryotherapy, in which you can observe there is significant reduction of size and volume of the keloid following the treatment. Now we'd like to jump into a quick literature review of existing studies around intralesional cryotherapy. And we took a look at a 2017 article published by Dr. O'Boyle, in which he reviewed articles spanning from the years of 2001 to 2016. And almost all these articles on intralesional cryotherapy report outcomes from small studies, and the median number of patients per study was around 17, and none of these studies included randomized controlled trials, and none of these studies actually took place in the US. So the first factor that was taken into consideration by the study was scar volume, in which one of these studies reported a mean reduction in scar volume of around 51 to 67% after one single treatment of intralesional cryotherapy. Now, the second factor was anxiety, in which one small prospective observational study observed a significant reduction of patient anxiety regarding the keloids following intralesional cryotherapy. Now, the third factor that's taken into consideration was pain and pruritus as reported by the patient following the intralesional cryotherapy. And these associated symptoms may be difficult to quantify. However, all the studies that did comment on these aspects reported a consistent and significant reduction in associated pain and pruritus, which represents regional itching, following intralesional cryotherapy. Now, the fourth factor that's taken into consideration was prolonged healing following intralesional cryotherapy, and slow healing times were common, as expected by any clinician familiar with the effects of a frostbite injury. And second to last factor that's taken into consideration was post-inflammatory hypopigmentation, in which when compared to a study group undergoing contact cryotherapy, patients undergoing intralesional cryotherapy reported significantly less post-inflammatory hypopigmentation. And the last factor that's taken into consideration by this review article was the recurrence of the keloid following the intralesional cryotherapy, in which reporting of rates of regrowth of these scars following intralesional cryotherapy is a little patchy and sparse. However, the studies that did comment on this aspect observed an occurrence of around 24% of treated scars. So now we'd like to present most likely the largest study cohort in the US to date of patients who have gone under intralesional cryotherapy. So this included a case series of around 53 patients at Northern California Dermatology Clinic who chose to undergo intralesional cryotherapy as their keloid treatment option. These patients were then retrospectively asked to answer 13 distinct questions regarding their patient experience, and responses were defined individually with respect on a 1 to 5 scale. Later, statistical analysis was performed using 4 distinct 2 proportions z-tests, and out of our 53 patients that we surveyed, 33 responded, giving us a 63% participation rate for our study cohort. So now, I'd like to jump into the data. So, regarding the first question that we asked them, we took into consideration before and after patient dissatisfaction regarding their keloid. And as represented by the blue bar on the left-hand side, over 90% reported that they were somewhat dissatisfied with their keloid prior to the treatment, and as represented by the last 2 orange bars on the right-hand side, around 50% reported that they were somewhat satisfied with their treated condition for the keloid. Now, the second question that we asked them was how likely they were to recommend CryoShape to other patients who might be looking into different keloid treatment options. And as represented by the blue bars on the right-hand side, around 50% would recommend CryoShape therapy to other patients looking into keloid treatment options. Now, the third question we asked them was about recurrence, in which, starting from the left-hand side, a little over 25% reported no recurrence of their keloid scar after the treatment. Over 30% reported around 1 to 25% of original growth. A little less than 30% reported around 25 to 50% of original growth, and less than 5% reported substantial growth, which is defined as 50 to 75% of original growth, and less than 10% reported around 75 to 100% of original growth following intralesional cryotherapy. Now, some additional metrics that we took into consideration regarding patient satisfaction included self-esteem, in which, as represented by the blue bars on the left-hand side, around 90% reported that their keloids had somewhat negatively impacted their overall self-esteem prior to the treatment, as compared to as represented by the orange bars, over 50% reported that their keloid that was treated with intralesional cryotherapy had a somewhat positive impact on their overall self-esteem. Secondly, we took into consideration the overall self-confidence of the patient before and after the treatment, and as represented by the blue bars on the left-hand side again. Over 80% of patients reported that the keloids had somewhat negatively impacted their overall self-esteem, and as represented by the orange bars on the right-hand side, around 60% reported that their treated keloid condition had a somewhat positive impact on their overall self-confidence. Now, the second to last factor that we took into consideration regarding patient satisfaction was the overall body image, in which, as represented by the blue bars on the left-hand side, over 80% reported that keloids had somewhat negatively impacted their overall self-esteem prior to the treatment, as compared to the 50% as represented by the 2 orange bars on the right-hand side. That 50% reported that the treated keloid condition had a somewhat positive impact on their body image. Now, not displayed on the screen is an additional factor that we took into consideration, which is regional itching, and we'll cover that in our statistical analysis. So, regarding our statistical analysis, we conducted 4 2 proportions z-tests for comparing the metrics of regional itching, self-esteem, self-confidence, and body image before and after the treatment, with their alpha level being 0.01 and a null hypothesis being that there was no significant difference between any of these metrics as reported by the patients before and after the treatment. So as you can see, the computed p-value for our regional issue metric was 0.223, which is above our alpha level. So we cannot conclude that there was a significant difference as far as regional issue goes before and after the treatment. However, for the metrics of self-esteem, self-confidence, and body image, there was a drastically lower computed p-values for each of those two proportions z-tests before and after the treatment. So we can conclude that there was a significant difference between the before and after self-esteem, self-confidence, and body image of the patients following the intralesional cryotherapy. So from this data and from the statistical analysis, I think conclude several things. First, that patients were generally satisfied with their intralesional cryotherapy. As we reported, there was an increase of self-esteem, body image, and self-confidence. And some clinical benefits include flattening of the keloid and reduced scar volume. And for this, we'd like to ultimately conclude that intralesional cryotherapy can be, and has proven to be, a viable treatment for keloids with a reasonably high patient satisfaction rate. Now we'd like to acknowledge some limitations of the study before we close. First, that this was a retrospective and non-randomized study, and there was recall bias involved, as some of these patients may have been asked to recall events from over 6 years ago, as some of the earliest cases took place in 2015. And there was a limited number of study subjects, as we mentioned. Our study consisted of 33 patients in Northern California, and lastly, there was a lack of data for clinician assessment of the keloid before and after the treatment. So now I'd like to acknowledge our primary investigator, Trina Neer, and our senior author, Dr. Ingrid Rini, who is a board-certified dermatologist. And we'd like to jointly thank California Dermatology Care for providing logistical and financial support throughout the entire process. And with that, before we jump into the question and answer session, I'd like to say that since I'm not the primary investigator, if you have any clinical questions and technical questions, then I'd like to refer you to the following emails, and we will get back to you with answers as soon as possible.